And we are back. Welcome back, everybody. I hope you're able to make good use of the time. Bio break, extra fresh cup of coffee. Shall we dive right in, pick up where we left off, and hand it over to our colleagues Leslie Schween and Kristen Thompson for rescue and CPR. And then we'll go to barriers, entrapments, and electrical safety, followed by structure and governance with Julie Lopiccolo. Hi, Leslie.
Hello, can you see me and hear me okay?
Yep, sound good and can hear you. Is Kristen joining us as well?
I don't think she is. She had said she was teaching today.
No problem. All right. Take it away, Leslie.
All right, so my name's Leslie Schween. I'm a Marine Safety Officer for the City of Huntington Beach Fire Department in our Marine Safety Division. So I'm a full-time lifeguard, and I've been doing that for 13 years. And I'm the co-chair of the Rescue CPR group. My counterpart, Kristen, is a battalion chief for the Newport Beach Fire Department, and she couldn't be here today, but I'll be presenting our findings, and just want to start with a big thank you to my working group. We've had some really good conversations where we pretty much run out of time. So thank you to everyone who's participated. Next slide, there we go. So to start, I'm going to talk about our gaps. So first gap we identified is there's a lack of dedicated education for field personnel that's specific to pediatric pre-hospital care. So the big thing is, we get trained. As a field responder, we're trained in CPR. We do child CPR, but one of the big things is we don't get the high quality CPR training. So that was one of our gaps. Data and information sharing. So consistent collection and gathering. So I know that kind of goes into what the data group was talking about, but a couple of the things that our group brought up was specifically how drowning is classified and what terminology we use. AED data was a big discussion, and the pre-hospital care information and the need for information from that first person. So the real first responder. So maybe at the hospital, you might get the PCR from the paramedics, but maybe you're not getting that data from, the lifeguard who pulled that person out of the water, or someone who maybe initiated CPR. So that's one thing that we found was a gap. Another thing that came up was the consistency in run cards for dispatch centers and EMS personnel throughout California, specific to drowning, rescue, and CPR, and what would be safe to recommend if we were to come up with something. So we'll talk a little bit more about that later. A rescue awareness education that is accessible for how to effect a rescue. If I were to come across a person, I would know how to do that, but maybe someone else who hasn't been trained in water rescue would not have the slightest idea on what could they do to help this person if there's nothing around. How could they help them? What could they do? A lack of dedicated education and training for parents specific to rescues and CPR. And then limitations on updated training and new procedures. So it seems from some of the comments we received, not all agencies had access to the most updated information or maybe the most updated training tools. So for example, maybe the AED trainer that someone has is not reflective of any of the ones that are on the market today. So these are some of the gaps that we identified. And next I'll talk about the goals that we've come up with. So identify a champion for pediatric drowning prevention within the different first responder departments. So for example, someone from the Newport Fire Department, someone from the Huntington Fire Department, different EMS organizations and community groups. Someone who is in each of those organizations who would really be focused on drowning prevention and how can we continue to push that forward with the rest of our organization. The creation of specific talking points for pediatricians and hands-on training for parents as soon as children are mobile, but maybe before they've been trained in swimming. So one of the suggestions was working with the American Academy of Pediatrics and coming up with maybe at a certain checkup, they have a discussion with the parent and give them that training on CPR and educating them on how they could rescue a child. Forming cross-sector partnerships to reach a greater audience. So, how can we work with the American Heart Association, Red Cross, different city parks and rec departments, and again, the American Academy of Pediatrics. A bystander awareness training. So when should they call 911? What do they expect, or what should they expect to hear when they call 911? What questions will you get from that dispatcher? Educating the public on what information is useful if they come across a situation where they have a water rescue or CPR is in progress, how can they get the information needed and kind of know what's needed ahead of time. With the one goal with the run cards, improving and maybe creating consistency across California for those run cards, so that when an ALS response is sent to a call, they're getting this same information, whether you're in Orange County or you're in San Diego County or LA County, just making it more consistent, which also would then in turn help with data because it would be consistent. Improving the sharing of AED download and data. So this came up in a good discussion where we talked about a lot of members of the public. There may be places like pools or tennis clubs or public access places that have AEDs, but they don't have the software to download the AED data. So maybe working with those agencies to make sure the local hospitals can get that data from that AED's use, so they understand, what happened with that patient in the pre-hospital care. Another goal is to research high quality CPR and see, in California, who is trained in that and how are we doing compared to the other states. And then another goal is to have a decision-making tool for the public for rescue, so a go or no go, and a separate one for what we would refer to as other trained individuals. So EMS, fire, police, people who have some form of training, but maybe not specific to rescue. And then we'll talk about our actions that we've come up with. So all schools with a health class should require CPR training. This would empower the adolescents and get early CPR training, and it would capture a huge part of the community. If it's required, they'll do it. Those health classes will include it, and that's something that could save a life. Have barrier masks co-located with AEDs to remove concern over mouth-to-mouth CPR at all locations for possible aquatic incidents. So this is something that, because with water is unique, everyone's pushing hands-only CPR, which is great for that cardiac arrest in the grocery store. But with water, we need to get oxygen and they need breath. So putting those barrier masks with AEDs, especially at ones that are at pools or places where there could be a water rescue, could be one way to reduce that concern for people. We want to create a suggested run card for drowning, including the questions that the dispatchers would ask that would be distributed throughout California to the different dispatch centers. A coordinated campaign to identify and train pediatric drowning prevention champions. And it was pointed out that, we need a top-down approach with this. Like, there needs to be a directive from the state of California. Identify specific individuals in the organizations who can help build those cross-sector partnerships that we talked about a little bit earlier. And then to create an algorithm or decision-making tool for our non-trained rescuers and our other trained rescuers to assist in when they make that decision on whether or not they're going to make rescue or how to effect a rescue. So the acronym that we use, I think it comes from Swiftwater, but it gets used a lot, is reach, throw, row, and go or no go. So, can I reach the person with my hand or with maybe one of the hooks, a shepherd's hook at the pool? Can I throw them a flotation device? And then giving them a point, questions to think through of, at what point do I make that decision of go or no go based on their skills, their ability? Have they been swim trained? Do they have other things they could use as flotation, such as an ice chest or something that's just sitting around that could float? Training parents in CPR and basic water rescue awareness during the swim lessons for the child. So, in a lot of swim lessons, the parents sit there and watch, but sometimes the instructors like to have time to work with that child without the parent getting involved. Having maybe, once a month, have a lesson where the parents are going to learn CPR and maybe go through some of these rescue techniques. How could they grab the child? What can they use to reach? What's some common items around the house they could use to float, just to give them an education. And then finally, to create pictographs for rescue and CPR. So simple pictures of how to use these rescue tools that you're seeing at pools. So tubes, hooks, a rescue can, and those could be located at places with like HOA pools, hotels, jacuzzis, And we were reminded to make sure, we're considering all types of needs. So including maybe something like an auditory rescue button for those who are visually impaired, something that would tell them, that they're affecting a rescue. Next slide, please. So special considerations. So the pool one, I forgot to erase from one of the samples, but we focused on the different parts of California. So, I'm here in Southern California and I'm very ocean focused because of my job, and I know that's a lot of what we do for outreach, but talking to some of my colleagues in my work group, they were saying, if you're up in Central California, the focus is on river and changes in the river and how that will affect. I don't necessarily know much. And as a kid, I didn't know much about rivers. So if I were to go to a river, I would be out of my element. Yes, I could swim, but I wouldn't necessarily know. So, better education throughout the state for all of the different types of water. So that's why you'll see it located in all of these different sections. Focus on the children, training the child on water safety, and they'll be that advocate for themselves. Like what was talked about with, training that child to put on their life jacket, making sure that goes with them every time they go to the pool. Another consideration we talked about was for in the hospital or the doctor's waiting rooms, maybe safety videos on water safety and life jackets aimed at the children. So when they're watching it, they can be empowered to take charge of their safety. And populations of concern, similar to a lot of the other groups, having multilingual materials, people who rent, and new immigrant populations. So people who aren't familiar with the area, maybe they're new here, they don't know about certain types of water, making sure we focus our efforts on those groups. And some of the activities that we talked through, so for the policy and legislation, programs having an education component that require funding, the parents, the parents will attend these. That's one part that we said was important, which has been talked about, the funding. So the different education messaging, we've got the decision-making tool, the pictographs, and the hospital doctors' waiting rooms. We also did talk about the life jacket loaner stations, specifically talked a lot about near rental facilities, which also goes into the public awareness and marketing. And it came up in the last presentation, the rental equipment and not having safety information. So what we thought of was think of an airline safety card and have that for water safety, rescue, and even some notes on CPRs that are given out every time, someone rents a boat, a stand-up paddleboard, a kayak, just so that it's part of the education as we reach out to these different groups. And then data collection, as has been talked about throughout, always working towards getting better data. So sharing of the AED data and downloads, and possibly looking at something that's maybe a subset of the pediatric death review, but specific to drowning, and getting people who focus on drowning and seeing what's being gathered, where do we need to target our efforts based on that data that's been gathered. So I know that was a lot. We've had some really good conversations, and I'm excited to hear from you and get to hear what everyone else has to say.
Wow, Leslie, thank you so much. Man, the amount of information that this group has come up with in just a couple short meetings that you've been able to present here today in just a couple minutes is remarkable. Great job. Thank you for that. Questions and comments from the group. I know that there was a lot of stuff in here. If there is anybody who wants to make a comment, I'm itching to use this raise the hand feature in Zoom. So if anybody does want to talk, would love to let you talk. And I'm just seeing some positive responses in the chat. Dr. Simonian says, we should consider doctor practice, social media, and website links for recommended PSA messaging and videos that may be available. Many parents in waiting rooms aren't always best location to be receptive to other messages. So yeah, again, talking about the messaging, and this is something that I think has come up for the 4th or 5th time now, and this is probably an area where we can collaborate quite significantly on, is this messaging. So other comments or questions? Anybody else from the CPR or rescue group come in? Leslie, the conversations that you had, as I understand it, we're quite focused on the CPR aspect of things. Can you just touch briefly, and I know that you had some of it in there, but can you just touch briefly on what does the rescue side of things look like? And please feel free to bring in some of your experience on working with the National Water Safety Action Plan on the rescue side of things.
Yeah, so we were very CPR focused. We had a couple of extra meetings where we added a couple of members from the other groups that were able to bring in some of the rescue side, as well as my background. And I worked on the National Water Safety Action Plan with Rob in the rescue CPR group. And that's kind of where the decision-making tool first came up. Rob and I had talked about that. So thinking about what can we do here in California? Well, why don't we make that tool and then it become, maybe it becomes the national tool after. But since it's something, that I've been part of both, that was one big part that I think came out of my work with the national. The other parts that came up with the rescue side were when we talked about having pictographs, that part came up, and the life jacket loaner stations. So those two came up in more of our rescue. And then a lot of times I was able to add, we talked about having CPR training at the during the swim lessons, or during the doctor's appointment. So I just added rescue. Why not just add a rescue aspect to it? We can come up with simple conversations, and I call it awareness, because we're not training you and we're not certifying you in rescue, but we're giving you an awareness of what can you look for. I saw Will mention in the chat our SALT program that we started. So we specifically call it an awareness program because we're making you aware of the hazards at the beach. So, I could give that to anyone and say, these are the hazards you might see, and these are ways you can help, teach your kids to get out of them, or they can get out of them. So that's where, for me, focusing on awareness as opposed to a certification comes in really big.
The point is, I think, really well taken about finding places where parents already are, and swim lessons is a really good example. And there may be some complications with like the doctor's office because there's so much happening at the pediatrician's office, but the swim lessons one is really interesting, right? So when I was working at Hogue, I did some work with the Newport City Aquatics and Corey and Irvine, and we piloted and tested this program where all the kids would jump in the pool, and normally every parent just looks at their phone and scrolls on Instagram for half an hour. And we said, okay, everybody get together, and we gave them this blast quick presentation that was 15 minutes with laminated slides. And one of the things that we did cover was CPR, not teaching people CPR, but talking about the importance of CPR and encouraging people to go find a CPR class. And then this, the importance of supervision and rescue. So it is really good, and I think important for this group, like you mentioned, to start thinking about reaching parents where they already are, and branching into some creative spaces could really be helpful. There's lots of programs out there that are working with parents, whether it's Head Start. Mary Jo had mentioned Head Start before, and there's some other groups. So yeah, starting to think about where we can get parents where they already are instead of creating something new that we have to get people to, I think is good. One question that's come up: did the rescue group discuss outreach or awareness to the public at unlifeguarded beaches or communities? And I think we can expand that out to just unlifeguarded open bodies of water in general. Or is there a focus on expanding lifeguard services to that area?
It's definitely a good question. We didn't talk too much. The one thing that did come up in some of our discussion, and I've done some research on it as well, is there's a lot of publicly available rescue device programs. So that's one thing that we could look at and seeing, that's really up to the jurisdiction and whether or not they want to put it. But I know South Africa has a program where they have it. Hawaii, there's a big one. And there are places here in California that have implemented that in places. You'll see it, for instance, in Huntington Beach, we've got life rings that are on the pier in 3 different locations, and they have been deployed at different times. But even thinking about it now, as I'm talking about it, there's no direction on it. It's just there, and it has rope attached, and it's assumed that you're going to know what to do. So even just talking about it now, it's like, having those pictographs maybe, and having it, very clear, like clear on when you would use it, which to me also connects to that decision-making tool on, you know, are you going to go or not? And how are you going to make this, make it work? And there's a lot of data, I would say, on both sides. There's a lot of research on both sides on how effective they are versus do they get stolen, vandalized. So there's a lot of considerations when it comes to that. But I think that's one thing to look at if there are unlifeguarded bodies of water, to have publicly available rescue devices.
Yeah, and I think again, this is another crossover conversation with the lifeguard and supervision group. You know, we started a conversation in that group about, you know, can this coalition serve as a platform by which to advocate for expanded services? And I'm thinking expanded lifeguard services in two dimensions. One, the season, right? So there's lots of places that have lifeguards, but they start on July 1st and they end at the end of August. Can we expand the season? Can we expand the time that they're there? Right? So there's a lot of lifeguard services that close at 6 and everybody wraps up. And then also to new locations. So I know that in the Central Valley, California State Parks has several lifeguarded lakes. When you compare the drowning statistics at those lakes compared to lakes that have no lifeguards, you can imagine there's a difference. So this is another crossover conversation that I think needs to be had between this rescue CPR group and the lifeguard supervision group. All right. Leslie, thank you so much. Thank you everybody for chiming in on the chat. Really important discussion here. The focus group session for rescue and CPR is going to be the 11th at 2 p.m. Right? Mm-hmm. Okay. The 11th at 2 p.m. And please note that was scheduled. That was a schedule change. So the 11th at 2 p.m. we're going to be able to jump in and parse some of these details out a little bit more. So, all right. Thank you so much, Leslie. We are going to move on now to barriers, entrapments, and electrical safety. And it is my distinct honor and pleasure to welcome Marcia and Mary to join us. These are two phenomenal individuals who I love dearly, and I'm so happy to be involved and lead this group. So Marcia, thank you so much. Would you first introduce yourself to the group for folks who might not know you, and then would be ready to jump into how this working group has been having these discussions?
Of course. Hi, everybody. Good afternoon. Love you too, Will. You're doing a great job, as is everyone. I'm Marcia Kerr. I'm in Orange County, between Los Angeles and San Diego. I'm with the Drowning Prevention Foundation, which is headquartered in Northern California. I'm the Southern California representative. I have also been with the U.S. Consumer Product Safety Commission as a product safety investigator. I'm retired and was there for 25 years. And lastly, but of course not least, I'm the mom of a 2-year-old boy, Cody, who drowned in our backyard pool back in 1988. This happened in Florida. We're actually Southern Californians, but we had actually moved to Florida to do water safety at the time that our son drowned. So we were really shocked and were determined that we would immediately start doing water safety and prevention. I also want to acknowledge Marianne Downing, who's my co-chair. She's in San Diego. She's not going to be presenting, but she's standing by for the chat box. So in case people have questions or comments, she can actually try to answer. She's with the Josh Collingsworth Memorial Foundation out of Lincoln, Nebraska, and she's also with the Prevent Drowning Foundation of San Diego. Next slide. I put in a lot of information, so I'm just going to go over some of the highlights of it. As you've seen before, it's just a ton of information. The members had so many suggestions and so many priorities that we just couldn't fit everything in. So I just took the top 3 that keep coming up. A few of the members thought that maybe these were rehashing older priorities, that they were out of date, but I think because they keep coming up so often, it means that even though we've had some activities in some of these areas, that the goals have not been met. So we want to readdress these. And will, once again, lack of data, I don't know how many times now, probably every group. I was going to say we can just go back to Erin's presentation and Leslie's, and that's my whole presentation. But specifically, we're focusing on lack of information, uniform data collection regarding barriers. So I'm going to go horizontally, gaps, goals, and actions. I think it flows better that way. Also, Michael and or Matthew, could you tell me about halfway through, because I don't want to run out of time. So that would be great. As far as the barriers, we've kind of focused on mainly the swimming pools and spas, but we also know that there could be a use of barriers with open water and also auto submersion. So as far as the lack of data for the pool barriers, we'd like to know a little bit more about the types of barriers in use, the number of residential pools protected, and especially very important, the location of the victim just before the incident. We use terms pool closed and pool open. If the pool is open, then especially the children are going to be inside the barrier, and that's going to be usually lack of supervision or water competency. If the child was last seen inside the home, then, and there was a barrier present, then that means that there was probably some type of problem with the barrier. So we'd like to know more about that, because depending on where the victim was located, the prevention strategies are different. Also, open water, we'd like to know about high incident areas where people have drowned, fallen in the water, perhaps non-fatals. We want to know if the use of barriers or self-rescue products in the water would have helped in the community. And then also auto submersions. As far as the goal, once again, we'd love to see establish statewide uniform reporting system for all water-related injuries and deaths in California. We talked a lot about establishing EMS. They're our first responders. We'd like to see more in-depth investigations and trainings and collection with them. And then finally, the actions are to partner with our fellow data work group and the CPR and Rescue groups, really all of them, to figure out a successful data incident reporting program, what's the most successful, the most efficient, and also to work with the EMS to see if they could use new electronic reporting. They do have those capabilities now, the data collection goals, and just to discuss what we can do throughout the state. As far as gaps with our Pool Safety Act, our California barrier law, we'd like to see increased information and training for the realtors, the home inspectors, the mortgage companies, so they know what's going on when they are around the actual home with the pool, so they can better serve and enforce the Pool Safety Act. So once again, we need to increase the knowledge of the realtors, the home inspectors, and the mortgage companies. And the actions would be to develop these programs. I think there are some programs already with some of these associations, but we need to really step it up and make sure that these folks get the training they need and the materials they need. We even proposed a train the trainer session, maybe several sessions around the state, either Zoom meetings or in person. And finally, the lack of public awareness as far as the drowning problem. We still need more work in the types of products that can protect pools and open water hazards. Will passed out or shared with us some studies from Amsterdam and South Florida, where we saw that especially in incidents where inebriated younger males were falling into the water after they left a tavern or a club, that the use of barriers like a fence or even products inside the water where they could pull themselves out seemed to benefit and lower the incidence. So we'd like to see in California those incidents and see how what's happening with them. So we want to create public awareness and an information campaign and see if these different types of barrier products can actually be effective. Next slide. Oh, there was one other thing I wanted to say about the gaps and the barriers that wasn't on the chart. Just because I don't think it can be done statewide, but it's very important. We did bring this up at the national level, and that's more studies. There's a big gap in research on the barrier products that are available. We know that the fence has been studied, but we don't really know that much about safety covers, alarms and cameras. There are some small studies going on, but we don't know enough research. There are voluntary standards that govern these products, but we really need to work at a federal level so we can really effectively and scientifically include these products in the barriers. Now the entrapments, we do know quite a bit about the public entrapment in swimming pools because of the Virginia Graham Baker, but we have a lack of data on the residential pool entrapments and especially what products are being used. Are there newer drain covers? Are there vacuum release systems in residential homes? I think with the newer homes there are, but there's so many older existing residential pools, we just don't know what's going on with them. And also auto submergent incidents, I don't know about the data. There is probably data, some agency has it, that's outside water safety. I'm going to be mentioning those in a few minutes, but we'd like to see some of the incidents on those. So the goals would be to incorporate the entrapment incident information, as we mentioned in the barrier goals. Just ask more questions about entrapment, especially in the for the residential pools, and partner with the data group once again to implement all of this. Lack of public awareness regarding suction drain entrapment. I don't think the public really knows about this. Years ago, I think my mom talked about they wanted swimmers to wear bathing caps because hair got caught in the drain. I don't know how she knew about that. I didn't even understand what she was talking about. I was a kid. So some people know, but I don't think it's widely known. So we really need to do more about that. When pools change hands, there's little or no education about entrapment or prevention products that may or may not be in the pool. And then once again, car entrapment prevention, I don't think people know enough about that as well. We need greater public awareness about drain entrapment, and also about when auto entrapment immersion occurs, people need to know first about how to prevent it, and then how to escape if they're in a car where they can't get the windows down and so on. There are some little tools. So we'd like to expand any existing campaigns that target the pool drain entrapment and broaden that to residential. And then also with the car entrapment, the submersion, public information like the Department of Motor Vehicles, the California Highway Patrol, all of those probably, I think, do have programs, and we can expand on those through our California coalition. Mary loved the turnaround, don't drown. I think that's a great term that we can remember. And I think that was focusing on flash floods or rivers, little streams that become rivers in torrential rains, that you shouldn't drive into them, you should turn around so that you don't get caught. Kids in Cars is another national organization that can help us also with those programs. The lack of public knowledge about entrapment when swimming in lakes and ponds due to vegetation overgrowth and submerged hazards. I don't know how many people know about that or think about that. There's a lot of seaweed, submerged trees. Steve Barrow brought up the exposed rebar, possibly construction materials under the water. So we need to identify and assist with groups already working with open water entrapment. Next slide. Finally, electrical safety. I did a lot of work with electrical safety while I was with Consumer Product Safety Commission. When going back to the pool ownership, when pool ownership changes hand. I don't think many people talk about the ground fault circuit interrupters being present, the wiring and the lighting. I don't think there's many materials covering that can actually be given to the homeowner. I think the pool service people can really help out with that because they're the ones that look at all this equipment and they know the pools pretty well. So the goals would be to, once again, educate home inspectors and the realtors about more about pool electrical safety. I'm not sure, they probably know some. There are other types of inspectors that come in when the pool ownership changes hands, so we can work with those people as well. Also, dock owners. There's electrical lighting safety. It would be good if we could see the pool and dock owners actually take an online course and pass it so that they can maintain their homeowners insurance. So once again, partnering with home inspectors, realtors, and all the other people that actually already have this material and the training materials, so we can just expand with that. Homeowners don't typically have documentation showing when the ground fault circuit interrupters were installed or maintained, if the wiring was looked at. Once again, we could work with the pool service people and also with boat docks. I had a little story about, I actually have a boat dock. I didn't know that much about boats or docks, so I really had to learn. Handyman installed a ground fault circuit interrupter on the side of my dock, which is close to the water, which I don't think is safe. So I'm going to actually have to look into that. But I think other people in my neighborhood just wouldn't even think twice about that. So we need to get more information out about that. And then finally, under gaps, the information about electrical hazards during weather-related dangers, like lightning, flash floods, where lightning occurs, and other weather hazards. I imagine that there are tornadoes near water in central and northern parts of California with lightning. So we just need to do better. Better weather information needs to be provided to the public. I think with the lifeguards, they have flags and signs and so on, but I think that especially with our residential and public pools, that maybe we're not doing a great job, and we could have the coaches and lifeguards help us with that. Do we have time for the next slides? We have lots of.
Yeah, thank you, Marcia. What I think we might want to do, just so that we make sure we have enough time, is we can spend a little bit more time on this during the focus sessions.
Okay.
These subsequent 2 slides, but I think that we should give folks an opportunity. Are there any comments or questions that we have for Marcia at this point, and before we move on to structure and governance?
I did see some comments out of the corner of my eye as I was speaking, but I couldn't really read them.
So
And
Mary
if
Jo
some-
Quintero, oh, go ahead, Will.
I was just going to say, and if somebody wants to chime in, they can raise their hand and I'll unmute them. Go ahead, Matt.
Well, it looks like you responded, but Mary Jo Quintero, it will cross injury prevention lines between MVC and water safety. That needs to be placed in the mix as well.
That's a really important point, and something that we've been thinking a lot about is where does water safety intersect with other things? So Marcia brought up the car entrapment, and I think that's what Mary Jo is referring to, is a really good example where us water safety people need to be aligning ourselves with other agendas, whether it's motor vehicle. And then Marcia, you just brought up the point about extreme weather. And I think that this is something that is continually coming up. Marcia, you talked about it specifically from an electrical safety perspective, but as the climate change, emergency response, disaster preparedness conversation is elevated at a local, national, state level, it would be wise of the water safety sector to be a little bit strategic about how we frame that issue in terms of water safety. And this electrical safety component is something that I have not thought about. So yeah, thank you for bringing that up.
We're focusing on this quite a bit through the National Water Safety Action Plan. So, and it really opened my eyes because I did work with it while I was with CPSC, but kind of forgot about it a little bit. I personally tend to just do the barriers for toddlers around swimming pools. So some of us, you know, if we're not working with other focus areas, we tend to forget. So we really want to broaden electrical safety, water safety for older consumers, multilingual. And also one thing at the bottom, I know we should move on, but one thing that was brought up were the autistic, the seizure disorder, and special needs populations, and the suicides and homicides. Remember that the intentional versus unintentional prevention strategies are really different. So we really have to think about that.
They are different,
Thanks,
but
all.
sometimes, yeah,
Oh.
but sometimes I think that there are strategies that work for both, right? Like something like a barrier on a bridge could strategically be used for both. And I think that is where, again, these cross-cutting conversations need to happen. So, Marcia, thank you so much. The Barrier, Entrapment, and Electrical Safety Group will be meeting on the 11th at 1 p.m. The 11th at 1 p.m. and we can really dig into some of those issues there. So awesome. Thank you, Marcia, and to Mary for leading that group.
Thank you.
Okay. We've already done water competency. We're now going to move on to structure and governance. So Julie, thank you so much for joining us. Julie's going to help us walk through these slides. Julie, can you introduce yourself first and then walk us through kind of the conversations that have been happening around structure and governance for a water safety coalition?
Yes, thank you, Will. So my name is Julie Lopiccolo. I'm the co-founder along with my husband at the Jasper Ray Foundation. Like Chris, Karen, and Marcia, I came into this space, a bit unwillingly after our 21-month-old son, Jasper, drowned in a neighbor's unfenced pool while under the care of our babysitter, and that was in 2014. Currently, I'm sitting with Dan Przansky and others here today on the leadership committee of the OC Drowning Prevention Task Force, and I'm also serving as co-chair of the Barriers, Entrapment, and Electrical Safety working group for the U.S. National Water Safety Action Plan. I'm a practicing attorney here in the city of Orange, and I have two beautiful children, Luna and Archer, 5 and 3. So this is a little bit, kind of the boring stuff for most of us, but it's really important that we talk about how to set this organization up to have a sustainable future and organize it in a way that promotes inclusion and transparency. So will you move to the next slide, please? So the vision is within 12 to 18 months that we form an independent 501c3 nonprofit organization that will be registered with the IRS in the state of California. There will be a board of trustees or a board of directors that will drive the group, and that will be comprised of individuals in the drowning prevention space, but also beyond, having any specialized area of expertise. Anytime you form a board, you want to have a sort of cross section of the community. So maybe someone who's great in marketing, for example, or an expert in board development, something like that. So one of the benefits of setting up a 501c3 is that we can really define what our mission as a group is. It's going to lend legitimacy to the organization because of the strict requirements of the 501 of the IRS and the corporate formalities that have to be filed. And some of these things will help us adhere to board governance best practices, which will be guided bylaws, board member job descriptions and agreements. There'll be formal orientation for the board and onboarding, assessing the board and how they're doing, having a conflict of interest policy so that board members who are working in other sectors or in the same space can identify sort of their commitment to the board above and beyond their positions in their own organization. Term limits, so we make sure that the board is changing and evolving, and of course, again, a focus on inclusion and transparency. So this will be set up and guided by external legal counsel. We've put feelers out all across the state and a request for nonprofit attorney help throughout the state. And we've put an application in with the Public Law Center that was accepted for pro bono legal services. So we will have help from the Public Law Center's in-house counsel for the setup of the 501c3. And again, the timeline is the 12 to 18 months because there is a bit of a backlog of the IRS. It's also a pretty cumbersome application, but we will file the articles of incorporation right away, and the organization's start date will be retroactive to the time that we file the articles of incorporation. So if there is funding or anything that's coming in, it will be retroactive to that date. So another really important thing for funding purposes is that if we have a 501c3, we can hold funds, we can fundraise. Other 501c3s like the Jasper A Foundation or Stop Drowning Now or other organizations that have to work within the IRS structure could partner with the coalition, partner finances with the coalition and stay within their own requirements as well. So that's really important. Next slide. So initially our thoughts on this, and again, just like everything else, this is still in the very early planning stages, but we put some thought into what this will look like as a group. And we think there'll be 7 members of the board of directors. And this board will be the strategy, policy setting, oversight, and governance body of the organization, of the coalition. And then the advisory council and working groups that you heard from today are really the intellectual engine of the coalition. These are the experts in our community that are really going to inform what the coalition takes up as a group, what work we engage in, if there is any funding to be distributed. While the decision making might be at the board of directors, the guidance and the expertise is going to come from the working group and the advisory councils. And then the water safety network is everyone else that it has expertise in this area, is working in this area, a stakeholder in this area, all of the people that Mike and Matthew interviewed and are engaging, that those are all the members of the organization. Next slide. So this is just a bit of an infographic so you can see the structure. The board of directors again in the top square with the outside legal counsel, and then the advisory council being the working group chairs and their working group members, and then the water safety network, of course, being engaging the larger communities. Is a big state with a variety of concerns and interests, and we want a goal of the organization and a challenge of the organization is always going to be to keep the larger water safety network and community engaged and involved and informed so that the coalition is effective. Next slide. So now again, you have just another sort of table that shows where we're at now, which is on the left-hand side. So we have sort of the coordinator or the executive director at the top with the current working group committees or the advisory council committees in the green. We've talked about there being other kinds of working groups, and a lot of those ideas have really come up today through the work that the working groups are already doing. And you can see those sort of ideas with question marks in the pink boxes. And I'm sure all of us can, add to this already. So, and then of course, in the bottom, you have the water safety network that's informing this work and where really everything is coming from. So some of the potential activities of the California Water Safety Coalition, remembering again that this is really set up to be an umbrella organization that brings together all the various pieces. Maybe the annual summit, and you can continue, that the Ben Carlson Foundation has set up and has been doing so effectively. The quarterly advisory council meetings, so the board getting the information from the experts in the field that are working and engaging with the community with their working groups, area specific webinars, in-person workshops, such as like this would have been if we weren't on Zoom, but something similar to this. for specific tasks that we're trying to accomplish or goals that we're trying to achieve throughout the organization. And then again, the idea is that the Water Safety Coalition is going to be a central repository of the activities from the Water Safety Network, and a hub for resources, best practices, and high impact programming, and all of the ideas that have been talked about today, and these goals and action plans that are being advanced, be sort of the housing organization for all of those things.
Okay, Julie, thank you so much for walking us through that. You did a great job of kind of synthesizing where some of the current thinking is at. And I think it's really important for folks to remember that this is all evolving, right? And we're entering kind of a consultation process. We're going to discuss what Julie just talked about, the structure, governance, and legal in depth at our focus session on Thursday at 9 a.m. So if you have specific questions about this and you kind of want to chat or provide some comments or insight, we want to hear that. We're very interested in that. Either get a hold of us offline or maybe come and join us at 9 a.m. on Thursday. So, okay, I'm going to ask Rob and Megan to join. And Julie, I'm going to ask you to stay on as well. So let me just get this. Okay. Before we jump into this, I would just like to acknowledge the enormous amount of work that has gone into today, especially from the working group members. We saw 6 working group chairs present, but there's a lot of work behind those chairs. So we'd just like to acknowledge the people who have shown up for the meetings, who have engaged in outside conversations, who have engaged in texts and email chains and calendar invites and messed up calendar invites. So I just want to really express a heartfelt thank you to you, everybody who has been involved in a work group. So, okay, as we close out today, I want to hear from Julie, Rob, and Megan on just kind of a concluding remark or a big takeaway. So, Megan, you have a really wide scope. You work nationally, you work internationally, you've worked with a lot of different groups in different places. What stood out to you today, and what kind of concluding statement would you leave our group with?
Thanks, Will. So I just want to start by echoing what Will said and thanking all of you for your time and commitment to this effort. It's been really incredible. And I would say, the biggest takeaway for me from today's session is I'm just overwhelmed by the collaboration. I think that can be one of the most difficult pieces when you're talking about whether it's areas of open water, backyard pools, extreme weather events, drownings in cars and canals. I think that getting stakeholders to collaborate and to cross-pollinate ideas is the most effective way for us to really impact drowning rates, not only in the state of California, but as we said earlier, the rest of the country is watching what California is doing and is drafting off of your successes. So seeing this collaboration today is so exciting. I can't wait to participate in all of the meetings this week and really learn a lot from you along the way.
Awesome. Thank you, Megan, for being along on this ride with us. We're super grateful for you and for Karen and for the Zach Foundation's expertise and guidance in this. Julie, any big takeaways from today and kind of leading into the next couple days?
Yeah, I think I have to echo what everyone is saying. I've said this before in group settings, and when my son drowned, I thought nobody was doing anything about drowning. I just thought, what's going on? This is so simple. This shouldn't happen. And why isn't anyone doing something about it? And I've learned through this work that there are so many smart, incredible people like all of you that are on this call today, doing really, really important work, but that it is such a complex problem. I mean, I'm just constantly challenged and, intellectually challenged by this work in a way that I really didn't think was possible. And I think it's so critical that we keep, pushing the envelope forward. And the way to do that is to work together, because none of us can do it alone. So I'm just really grateful to be able to participate.
Thank you, Julie. Rob, big picture takeaways from today's session and leading into our sessions coming up this week.
Yeah, of course, thanks, Will. You make me go last, so Julie and Will, or Julie and Megan, steal my ideas. No, the best thing I look at is the networking possibility. Besides everybody doing all this good work, with exactly what Julie and Megan said, to be able to come together, collaborate, and to share the ideas, but also the ability to have this network of water safety professionals and these individuals that, if you need something, you can call Ryan at NOAA or the National Weather Service, or different people sorry, Ryan, I didn't mean to call you out there, but I mean, all these different organizations that have so many good people that have resources available to all of us. And we need to have this network available to everyone. So if someone has a better idea in Central California than we do in Southern California, we learn from that and we build on that. And so it's just an exciting time. And hopefully we're probably missing a good handful of people. And during the next 6 months or even the next 6 years, we can identify those people and bring them on board and continue this work. And this is the goal of this thing, is to be long lasting and not just go together for a year or 2 years. This should live in forever and ever and be able to go on without us in the future.
Those are such great points from all three of you. And I will just close with shamelessly stealing a metaphor from a water safety advocate named Justin Scarr, who talks about how we need a platform for drowning prevention. And what he means by that is it's almost like a stage to amplify all the work that's already happening. And on this stage, there's room for everyone. There's room for every perspective. There's room, which again, today has been so inspiring to see, a marine safety ocean lifeguard with a parent, with a data health, perspective. So there's room on the platform for everybody working in this space. And there's also room on the platform for everybody who doesn't yet know that they should be working in this space. And so growing that tent and growing that network and partnering and collaborating across, our geography, across our sectors, and between our different perspectives and the way we approach this problem, back to Julie's point, is the only way that we are going to move the needle on this really complex issue. So Julie, Rob, Megan, thank you so much for helping get this event off the ground. I am now going to ask Matthew and Mike to join us, and they're going to provide some nuts and bolts details on what is coming up next. And I will get the schedule slide back up here. Whoops. I'm going. Hang on. There we go.
Great. So starting tomorrow, we will have longer form, deeper dive discussions on each of these work group areas. So this is an opportunity for work group members to talk through feedback, questions for consideration that they received today. It's also another opportunity for others outside of the groups to share their perspectives and inputs after they've had a chance to digest what was shared today by each of the groups. Mike Silvestri said his head is exploding. So this is a chance really to further the conversation, deepen the conversation, get lots of different perspectives in a sort of longer format. So we really encourage you all to join those if you can. So this is the schedule for tomorrow and Thursday. It starts with open office hours on both days, which you're welcome to join. That's really an opportunity for the chairs in particular, if they wanted to come on and they're grappling with how do we incorporate this input, how might we restructure our gaps or our goals or our activities. So that's an open forum for you to join if it's helpful to you. And then of course you have the individual sessions as they're laid out there. Then on Monday the 15th, we'll have open office hours, which is an opportunity to just before we reconvene on the 16th for our formal updates and report outs, more guidance on that forthcoming. That's an opportunity for you to ask any remaining questions, and we'll be available as a core leadership team to support you. That's really it in a nutshell, Will.
Okay, great. Just as another way to close up, please mark your calendars for the 23rd and 24th at the Water Safety Summit. And if there's nothing else, Matthew, Rob, Megan, Julie, we're gonna go ahead and end it here. Thank you all so much for spending the last few hours with us. Hopefully this has been informative for you. There's a lot of work that has gone into each of these working groups. Thank you again to the working groups for all of your work. And we will see you tomorrow on your schedule and interests, if they align for the focus group sessions. If you have any comments, questions, or concerns, we're going to practice what Tizzy mentioned at the very beginning, which is listening and learning. So please do feel free to reach out to any of us via email or phone if you have that, and we'd be happy to discuss any of these issues further with you. All right, that's it for now. Thank you all so much. We will see you over the next couple days in our focus meetings.